Okay, we're doing this book here again, Prevent and Reverse Stroke and Heart Attack by Pete Rogers. That's me. We're on page 50, figure 2.7, the windkessel effect, if you're following along in the book. Okay, so what happens is when the heart pumps blood, it goes into the ascending thoracic aorta, which then is stretched outward by the pressure of the blood. Cardiac contraction is systole. That's the Greek word systole for contraction. Then, when the heart relaxes, the left ventricle relaxes, the elastic recall fibers in the ascending thoracic aorta, they recall inward, and that propels the blood during diastole. Diastole means relaxation in Greek, so that's relaxation of the heart. So in a sense, the ascending thoracic aorta functions as a second heart. It stores kinetic energy when it receives the blood coming into it, pumped by the heart, and then during cardiac relaxation, it has elastic recall inward to propel blood during diastole. And so then you get a blood pressure. Top number is systole, bottom number is diastolic. Okay, so what am I getting at here? This is called the windkessel effect. Windkessel is that thing, it looks like a little miniature triangular accordion to blow air on a fire to get the kindling to burst into flames. And chronic hypertension due to high-fat diets, high-sodium diets cause overstretching of the ascending thoracic aorta. And when that goes on for a couple decades, it overstretches those elastic fibers, and then they become destroyed. You can't replace them after maturity, so about 20 years of age or so. And this then predisposes a person to worse and worse hypertension because they can no longer maintain good flow during diastole. So the body has to compensate by pumping more blood during systole at a higher pressure. The reason you have a blood pressure is to get blood to the top of your brain, your cerebral cortex, and it has to be pumped against gravity. So loss of the windkessel effect is bad. You're going to get more and more systolic hypertension. You'll see if you look at hypertension charts, as people get older, their hypertension tends to be more systolic predominant. And it's a double problem, a double screw job, because the cardiac muscle, when it's contracted during systole, the muscle is forcefully contracted. You really can't get a good amount of blood into it. The left ventricle is perfused primarily during diastole. That's when the penetrating branches that go into the heart muscle, the intramyocardial branches, perfuse it, deliver blood to it. So what am I saying? You're going to have more prolonged, intense systole when you've lost your windkessel effect, meaning you'll need more blood to that left ventricle because it's pumping harder, but you'll be less able to perfuse it. You'll have a shortened diastole. You get it? It's a double negative. Okay? And people start getting more atherosclerosis after they've lost the windkessel effect because they're going to get higher systolic pressures. The blood's going to be transmitted at a higher velocity, and that's going to smack against the median divider. I'll explain what that means with the next couple of pictures. Okay, here we go. First of all, I'll just show you a picture of the endothelial cells. Endothelial cells are the lining cells of your arteries. They have a spindle shape that's orientated along the direction of blood flow. Okay? So normally blood flow should be passing primarily just along the same direction as the spindle-shaped orientation of the endothelial cells. And they've got little sensors that project above the cells that can feel the direction of flow. They can tell if the flow is normal or not. Okay, normal blood flow is what is called laminar, and laminar blood flow is like your hand. So the two fingers in the middle represent the red blood cells, and that's denoted by the red arrows right here. Then the fingers adjacent to them, those are the white blood cells. By the way, there's more than 99% of the cells in your blood are red blood cells, okay? Then the white blood cells will flow on the outside of them, and then further outside, like the thumbs, I'm putting the thumbs here, that is the plasma. The plasma is just, the fluid, the aqueous solution, that flows right in contact with the wall of the artery. And that's normal laminar flow. So it's like a parabola, a parabolic velocity profile of the blood. And that's how it normally should be. However, when you eat a high-fat diet, the chylomicrons, triglycerides, LDL cholesterol, they overcome the zeta potential of the red blood cells. They overcome the negative charge of the red blood cells. They have a positive charge in adequate size. They stick the red blood cells together. like this giant submarine sandwich. So now you're pumping thick blood. Instead of pumping blood that's like water, the heart has to pump a thick blood that's like a milkshake. Because you're pumping a thick blood, pressure has to go up, okay? Now I'm going to show you what happens, why hypertension is the #1 risk factor for atherosclerosis. Hypertension and high cholesterol, okay? So because the blood's coming in at a higher pressure, a higher velocity, a higher peak systolic velocity, it smacks against the median divider more hard. This is the external carotid artery. This is the internal carotid artery in the neck. Here's the common carotid artery. The way you can imagine is look at my wrist and forearm. That would be the common carotid artery in the neck. Okay. Then the internal carotid artery is a single vessel, just a thumb, no branches, and that goes straight up into the brain. These little finger-like arteries are these smaller arteries that go all over the face, external carotid. So that's how you can remember the anatomy here. So the blood is coming up like this. It's going to hit the median divider between the thumb and the rest of the finger. It's going to bounce off of that. When it bounces off of that, it's going to have an excessive amount, because of the high pressures of hypertension, an excessive amount of chaotic flow. Chaotic flow is called turbulent flow. In addition, some of it will just be retrograde. Retrograde flow is called eddy currents, retrograde eddy currents. So these sort of brownish maroon arrowheads here are the eddy currents along the far wall. This is the median divider, the soft tissue in the middle between the branch point, external carotid, internal carotid. And it's like this at all bifurcations. So the high pressure blood hits against this, excessive amount of turbulent flow, chaotic flow, excessive amount of retrograde eddy current flow. That confuses the endothelium of the internal carotid artery on the far wall away from the median divider. And that confusion signals to it that it thinks that there's been some type of vascular injury. So it sheds its antithrombotic glycocalyx. Glyco means sugar, calyx means coating, and it has these glycoproteins on its surface that have a strong negative charge, a strong zeta potential, and it just cleaves them and releases them. So now you're left with these lower down adhesion molecules like VCAM, vascular cell adhesion molecule. The mnemonic for, and I made this up here, the mnemonic for the lining of an endothelial cell is 666. It's like the devil's number, but in this context, it means something good for us, okay? The first 6 stands for 600, and the glycocalyx sticking up above the endothelial cells is about 600 nanometers. Then the vascular cell adhesion molecules, they only stick up about 60 nanometers, and the plasma membrane itself on endothelial cells is about 6 nanometers. Okay, so you normally will have no access of the white blood cells, red blood cells to the adhesion molecules until you shed the glycocalyx. That's why it's such a bad thing for that to happen. And this is where you'll form the first atherosclerotic plaque. Atherosclerosis is a blood clot. You need to know that. I said that earlier in this book, and that's one of the most important things you could understand about atherosclerosis. No, you won't find that in the conventional textbooks. They're all stupid. They all stink. They're all ignorant. The Harvard textbooks, they stink. Okay, I did my fellowship with the emphasis on vascular interventional imaging-guided surgery back in the 1990s, and I can tell you, the Harvard textbooks stink. I have the more recent editions. They stink. They're a joke, okay? You know, internal medicine books are designed to help you sell drugs, okay? Most vascular cardiology books are basically designed to help you sell stents and open heart surgery, okay, and medications. But the reality is low-fat vegan diet is the best way to treat this. Anyways, you will form a blood clot on the far wall from the median divider. I have looked at tens of thousands of CT angiograms. That's what you always see. And you can't tell a blood clot from atherosclerosis because they're the same thing. Okay, I've done hundreds and hundreds of catheter arteriograms. I've seen tens of thousands of MRAs, magnetic resonance arteriograms. I talk about this stuff every day, okay? Atherosclerosis is a blood clot. It forms on the far wall relative to the median divider. You get a little bit of plaque here too, but the far wall is where the big initial plaque happens, okay? And if little pieces break up, you can get small strokes in the brain, like a TIA, for example, transient ischemic attack, a Holland horse plaque like embolus to the eye. You can get transient loss of vision, okay? You can get retinal artery occlusion too. Amaurosis fugax, that sense of a lampshade being pulled over the eye, you can get that from these small emboli from the carotid artery. A lot of times a big middle cerebral artery stroke is a left arterial atrial appendage afibrillated stroke. But anyways, I'm making the point. This is how atherosclerosis starts, and I see this all the time. So this is why you don't want to eat high-fat diets. You don't want to eat high-salt diets because they vasoconstrict and it'll get the pressure to go up. High-fat diets will increase the blood lipids, give you more rouleau formation. Leaky gut will give you more rouleau formation. Excessive iron overload causing ferrous redox cycling will give you more amyloid clotting type stuff. So anyways, the main point of this talk was hypertension is caused by high-fat diets and by high-sodium diets when you have a high sodium relative to potassium. And the high pressure causes injury to the artery at the level of bifurcations, and the main clot forms on the far wall away from the median divider. This is the fundamental basics of atherosclerosis right here. It's a blood clot, and this is why hypertension causes it, and the rouleau formation blood sludge is why high-fat diets cause it, and the vasoconstriction is why high-sodium diets cause it. And the good news is, now that you know what causes it, you know what to avoid. Avoid high-fat diets. Avoid high-sodium diets. And then also, we'll get more into it later, but avoid anything that causes leaky gut or iron overload, because those will also lead to prothrombotic blood. Anything that makes the blood more prone to clot increases the risk of atherosclerosis. Okay, I hope you found that helpful.